Today, I'm going to open your eyes to the epidemic that is sweeping the nation, especially Tulsa. Studies show that estimated medical costs for those who have experienced diabetes even once in their life has skyrocketed compared to those who have maintained a healthy weight. I have conducted research into my own school's cafeteria and found frightening values on the nutrition labels, which explains their unwillingness to cooperate and reveal these labels about the food that they serve their students. Tulsa needs to be proactive instead of reactive and work to resolve this local obesity epidemic by educating the public, upgrading the city's infrastructure, and improving schools' lunches. Educating the Tulsa public is the first step towards finding a societal solution to this problem. Education is crucial to the development of the Tulsa people and vital to improving their well-being. Without education, it is impossible to truly understand the dangers and harm that this disease obesity can cause. James Rogers, author of Dangers of Obesity, notes the many repercussions of this disease. One being the collapsing of the arches due to excess weight that the body cannot handle. Second, joints become stiff due to limited motion due to excess weight and also potential disease that develops from obesity. Obesity also causes blood imperfections, which lead to issues with blood vessels and also cause heart disease and many damages within the heart. Obesity slowly causes the body to deteriorate, weakening it drastically and sometimes causing damages that can be irreversible. Education equips people with the knowledge to confront this health crisis and prevent it from happening. By promoting healthy lifestyles in schools, children can learn at a young age the importance of an active and fit lifestyle. TulsaHealth.org, which is affiliated with the Tulsa Health Department, talks about the Oklahoma Health Improvement Plan. This plan has many divisions, one specializing with obesity. This goal towards combating obesity includes the integration of nutrition and obesity programs statewide. They also implement programs backed with scientific-based evidence to help combat this issue. They also create public policy to help Oklahoma's fitness through the Get Fit, Eat Smart Oklahoma plan. Education works to inform the public about this problem, but without decent infrastructure, Tulsa is unable to act to prevent this disease from getting worse. Well-designed infrastructure works to improve Tulsa's longevity of the city and its people. Without an abundance of sidewalks, it makes walking dangerous and a sometimes impossible task. Shannon Muchmore, author of the Tulsa World article, Low Cost to Address Obesity Saves Big Spending on Healthcare, states that it is crucial to move at least 150 minutes per week. By having more sidewalks connecting neighborhoods to grocery stores and local shopping centers, walking around would be encouraged for small trips made to these locations. Building more sidewalks also allows people to live an active, more fit lifestyle by encouraging running and walking to maintain fitness. Focusing more on connecting sidewalks would help encourage an active lifestyle and help teach people that there is more than one mode of transportation, that being walking or biking instead of solely being reliable on a car. The lack of accessible bike trails also inhibits an active lifestyle. Muchmore also interviewed James Wagner, a transportation projects coordinator. He states that the plan is connecting neighborhoods to the existing trail system. Wagner's goal is to make this connection between neighborhoods and trails a seamless connection. This connection would encourage active lifestyles among people of all ages. The inhabitants of the neighborhood would have easy access to these biking trails, which would make for a great alternate to transporting by cars and making a great outlet for exercise also. Fitness is crucial to preventing obesity, but fitness is only half of the battle. Diet is another half of the battle contributing to obesity, and sadly, much of it resolves within our school system and the lunches they provide the students. Jeannie Graham, author of the Tulsa World article, Eating Sheep Led Kids into Obesity So Keep School Lunches Healthy, discusses the severe issues that come from the quality and types of food provided in local school cafeterias. According to Graham, childhood obesity has not dropped in rates since the 80s. It has only continued to grow. Schools have focused their attention on academics, and this tighter curriculum forces students from focusing on physical education and prioritizing healthy lunches to focusing only on academics and having very restricted time for any mobility. Graham states that childhood obesity rates in Oklahoma are at 17%. This puts us at a second in the nation ranking for childhood obesity within high schools nationwide. Lastly, Graham notes that an obese child will pay $20,000 more in medical costs over a lifetime, and this results in ultimately costing the United States a total of $14 billion in additional costs. Schools are setting up students for a disease and debt-filled lifetime by providing them food that is unsatisfiable for the nutrition grade. By doing so, they ultimately have a drastically negative effect on America's economy in the long run. Tina Moffat, author of Childhood Obesity Epidemic, talks about the framing of this epidemic as either a social problem or a medical issue. Is there a middle path? Moffat states, concluding that the issue should not have to be solely one or the other, but in fact it can be both. Moffat believes in bridging the gap between social gaps and the medical gaps, creating one so people can recognize that there can be more progress made by acknowledging both instead of solely just one. Many scholars have found aspects of biological phenomenon within the research of the obesity epidemic. Moffat is working to get the public to recognize the work of the scholars and that this can also be a biological problem as well as a social food intake problem as well, not solely one or the other. There are many contributors to obesity, and many more will still yet to be discovered. Tulsa needs to begin working with what they do know, how education, infrastructure, and diet are all elements lacking within the city, and if improved, it will help the city be more proactive about combating this obesity epidemic. Since obesity costs the state nearly $750 per adult each year, it is vital that policies be put into place to not only prevent unnecessary health issues, but also to protect Oklahoma's economy. Obesity is not a problem that will diminish with time. Rates have not dropped since the 1980s, showing that serious measures must be taken in order to combat this epidemic. Drastic measures must be taken to ensure the health and the longevity of our future generations and to combat the obesity epidemic that Tulsa is now facing.